to do all kinds of testing, including routine bacteria tests. And sometimes it's because the lab is just operating with physical distancing, and so there are just fewer personnel in the lab than they had conventionally. But in other cases, labs are actually also occupied with testing for the COVID-19 virus. And sometimes it's the same microbiology labs who might be doing potable water testing are also now doing virus testing. So this has created a lot of interest in actually monitoring wastewater. And so we've gotten involved in some experiments doing that in our lab, excuse me, where we're monitoring sewage samples for the COVID virus as part of community monitoring. But at the same time, every time we collect a sewage sample or one comes into the lab, we just take a little 1 milliliter sample out of that and put it in the TECTA so that we, alongside the virus testing, we can determine the E. coli and fecal coliform levels in that sample. And that's going to be important because when you get a sewage sample and you want to test it for the virus, it's important to know how much fecal content is in the sewage. The virus is going to be at higher levels on days when, for instance, there's not a lot of rainwater going into the sewer system and diluting it. So it's important to understand how much fecal content is in the sewage so that the virus test results can be corrected to adjust for other environmental events that might be affecting the results. So we've put together a system now where we can do community surveillance. And what community surveillance looks like is that individuals who are infected with the virus will excrete it. So it's going into the toilet and it's going into the sewer system. And so if you find a central point in the sewer system, all of the virus being contributed by multiple people, hundreds or thousands of people in a community, those virus samples are all being collected and mixed within the sewer system. And so if you go to the inlet of a wastewater treatment plant, which is at number 3 in this picture, that's now an integrated sample that's reflecting what is being excreted by every member of the community whose waste goes into that sewer system. And so it's a really convenient place to take a single sample that can give you an idea what's going on in the wider community. And so what we've done is incorporate a TECTA instrument into this process so that as the wastewater sample is taken, a 1 milliliter sample goes off into the TECTA instrument. At the same time, the rest of the sample moves forward into standard methods using PCR to test for the virus particles in the sample at the same time. And so the E. coli and fecal coliform results can be used to correct again for the fecal content in that sewage sample. I should point out we put a 1 milliliter sample in the TECTA. The results for most of our sewage samples come in about 5 to 8 hours. So we actually know the E. coli or fecal coliform level usually well before the PCR results are finished. And so that makes it very convenient measurement to do it in the TECTA. It's not occupying the time of the technicians who are working on the PCR analysis at the same time. And then finally, in a community surveillance program, the results will be used to say, if we know how much virus we're picking up in the sewage sample, can we relate that back to the level of contamination in the community or the level of infection in the community? And so if there's a spike in COVID-19 virus in a community, we should see the levels go up in the sewage. Or if a community is overcoming the virus and the levels are going down, again, we should see the level go down in the sewage. So it's a single sample that can be taken to replace hundreds or even thousands of individual tests of persons in the community. So that's turning into a really exciting application of this kind of testing when we get into public health situations to use sewage or what they call wastewater epidemiology as a way to more efficiently track what's going on in a community. So that's something the TECTA instruments now involved in different locations, and something we would like to promote as an additional benefit to using detector technology in the future.
Thank you so much, Stephen, for your information and for helping us understand how all of this fits together. One quick question comes up. Well, I have one quick question for you, and that question has to do more with this particular application of the detector. So does that mean if you are doing this community surveillance, that then governments and institutions can then start to channel resources to the communities or to the parts of the community where they see the level of COVID being present in their sewage, as opposed to the current method where they're just sharing and testing everyone irregardless? Would this really be one of the ways that you can start to channel resources to the right place?
Yes, the idea is that you can get community public health monitoring, but it's much more efficient than doing it by conventional public health means of testing people. And we're still doing the research to learn, you know, how many infected people do you need in a community before you start to see the virus in the wastewater samples. The initial results for that are just coming out. The data is looking very promising, meaning only a few infections in a community are needed before the signal starts to show up in the wastewater. But absolutely, you get the advantage of needing to do fewer tests. So that means you can devote other resources to responding to the infection rather than to just putting resources into more testing. And then there's also the possibility of getting the results earlier. So what really seems to be important for the COVID-19 virus is that people start to shed the virus even before symptoms are starting to appear. So you could have a number of infected people arrive in a community and start to excrete the virus. You may detect that in the wastewater before those people are even starting to get a fever and cough and realizing that some of them may be sick. So it's more efficient, and you may get an earlier warning that infection has reached a community or is increasing in a community than by the conventional methods.